Welcome to the Transforming Healthcare Coaching Podcast, where we bring you guidance and coaching perspectives so that you can level up in your life and work.
Happy holidays, everybody, from Transforming Healthcare Coaching. It has been an incredible year here at Transforming Healthcare Coaching, and we've done so much, and we are so excited to celebrate our team, but also to celebrate you guys, our healthcare professionals, our listeners who have been alongside us throughout this journey and giving us some insights and advice yourselves on how we can improve and level up in our own lives. Thank you. Hi, everybody. We have the whole team here. We have Lilly, we have Amy, Gillian, and Grizelda. What is one standout moment for you from this year of podcasting and coaching that we've been doing? What's standing out for you?
I am so amazed at this group. We've all met each other from all different parts of the country. We seem to have a very shared dedication and values, not only having fun, but also to spread the word of coaching for healthcare professionals. And we've really managed to stay a solid unit. It's been pretty incredible. And we all kind of chip in where we can, work together. And it's just been a real highlight for me to work with this group.
Thing I'd like to piggyback and also just, especially looking back, and I know, Klaus, you had mentioned it one day, we should totally have a bloopers series. Because before I'd be like, cut that, or leave it start, or I would just freeze. And now I feel that the more that we've gotten to know each other and just the comfort and my heart's not racing. And so I feel that hopefully our listeners have really been feeling that and growing with us and getting to know it.
I think for me, it's really been having the fun opportunity to interview really amazing guests on our podcast. I've really appreciated all of the different speakers and authors and other coaches who've been able to provide their expertise because I just love talking with different people. And I'm really grateful for the podcast swaps that we've done with other people in the field.
And I agree with everything that you've already said. And I would add that having spent the last year or so working on this, the need is very clear in healthcare that there's a lot of people struggling, and what we have to offer really is a great solution. The whole energy leadership way of coaching has really been highlighted to me as something that healthcare should really wrap their arms around and embrace and help staff and clinicians, managers, leaders get to a better place.
We really have embraced this growth mindset. We started this podcast March. It's going to be last year soon, right? And we are a part of this learning and growth that our viewers and our clients in healthcare are also partaking in. And I agree, the confidence that we've all developed as a result of this, the energy leadership that we are embodying, and our viewers are commenting on that. We've had amazing guest speakers who really just add value to our listeners, and we couldn't be more thankful for them. We recommend you listen to some of our older podcast episodes if you're interested. We've had some great guest speakers, and we'll comment on some of them later as we go through here. And so I'm curious, guys, how do you feel our podcast has made a difference in the lives of our viewers, our healthcare professionals?
I would say I think it's just so that they know they're not alone. They're like, oh, I actually didn't realize so many people thought the same way. And I didn't realize there were so many people who could help me. I think the most surprising thing I've heard is just that it's really well done. Our conversations are good. And also it provides little tiny tidbits to help keep reinforcing things they may have heard in other places and maybe not have taken it in. And it comes a little different just because they know that we've all walked that same journey. Or some of them are still walking that same journey, still in healthcare in the trenches with them. Just realize that they're not alone.
Yeah, and healthcare people are really good at taking care of their patients, but they're not so good at taking care of themselves. And so the podcasts are hopefully being reminders that you have to take care of yourself so that you can show up every day for everybody else.
And Lilly said, knowing that you're not alone, the feeling of community, I think in this group of people is so important. And even if people are just listening in and not interacting, I've heard from people that really gave them a sense of belonging. and not feeling so alone and overwhelmed. So it's nice to know the service of our chats online, our podcasts have been helping people. And also in groups that we do, there's just that shared element in a group that has a powerful way of helping people. So that's been nice to be a part of.
Just like to add one more thing, just the impact as far as us being able to come here as a collective and being able to demonstrate how coaching has impacted our lives. And that way, it's also that testament for others to say, this is how we do it. This is a solution that we're providing. And you could see it from us. You can see how we've grown or from our experiences and also that of all of our guests that have been coming on.
Yeah, we've been so honored to show our own transformations throughout this process. We believe in the power of coaching so deeply, us as a team. And I think what speaks to a lot of our viewers too is that we are all different healthcare professions or experience in healthcare professions, right? Ultrasonographer, occupational therapy, pediatrician, critical care physician, emergency medicine PA, right? So we come from different professions within healthcare, but we're all humans after all. We all come from a place of helping, and we don't want any hierarchy to be seen among us. We are walking the same path that you're walking, and we truly enjoy that journey. How have you guys grown as a coach and individual throughout this podcast journey?
I guess I'll start. Along with you, Klaus, you and we love the creative side. And it's one of those things where after 15 years in practice, where was the creativity anymore? Right. And for me, just being able to play and interview and go reach out to people who I think are cool on LinkedIn, people who are also doing the work and who also love to talk and be on podcasts. It's been really great finding a community of other authors and speakers and clinicians in healthcare, people who are leaders in healthcare to come on our podcast, begin to all do what we all want, which is to make healthcare different. And so I think for me, I've grown so much in terms of my desire for creativity now being a new value. So I do a lot of value-based workshops like we all do as coaches and trying to figure out like who am I and what is my meaning in life. And so this year I got to experience what creativity means and how important it was for me. So thank you for being my compadre and co-partner in crime here on the podcast.
No, I've enjoyed actually the same thing. And I think all us healthcare professionals can speak to that. Well, oftentimes we go into the field because there is a lot of continuous learning that we have to do. And to embody a part of creativity, which is hard to do in certain aspects of medicine, right? A lot of it's very mundane, repetitive. You're practicing the same style and art of medicine. And the ability to learn and grow and learn something completely new and refine it has been such a joy.
As far as growth, I love learning and I love hearing different perspectives, which makes me even a better physician and definitely a coach. Just always thinking there's other perspectives and bringing on these guests and just learning from each of you has been pretty awesome.
Just like our viewers, we too experience our own challenges in our own life, challenges as a company that is growing. What was a significant challenge that we faced this year, and how did we overcome it together?
Time. Time is always a big word that people say when we talk to them. I don't have time. We have all those challenges, but here we are. We meet every week. We fit in our schedules. We prioritize. And not only when we're meeting, but the work we do together filters out. And we all manage to get things done and weave it into our life. And obviously, we like to be models and feel we've embodied this work life balance. So I think we've been doing a pretty good job with that.
And I think really pinpointing who we can serve most effectively. We've had a lot of conversations around that. And as coaches, we're trained to be able to coach anybody at any time. But there's been a value in really figuring out who in healthcare we can serve the best and how are we going to do that.
I guess for me, I probably would say tech, right? So Klaus, you and I have probably been on the receiving end of most of the tech growth. And so I think for me, both learning all of the software and the software as a service and the ways to become more efficient has been an interesting process. And I think the reality is, it teaches resilience, right? In terms of, am I really going to let a software stymie me? And thankfully, you've been there to help pick up the other half whenever I'm like, I just can't figure this out anymore. Actually, our testimony for it goes better and faster and more fun together than when you just go about by yourself. Because when you're by yourself in the middle of the night trying to figure out why the software isn't working, it becomes really lonely.
And this has been a year of growth of technology, putting in the time. As Amy mentioned, time is a big thing among healthcare professionals. And as Gillian mentioned, it's been a challenge for us to figure out what the exact needs have been for healthcare professionals. Though we may walk the talk and have our own experiences, these experiences are completely unique to our entire audience. And it's been an incredible joy, actually, figuring out what that is for everybody. And please, if you have some more challenges that you're interested in, leave us a comment so we can have an episode where we talk about that. Or if you're interested in more personalized support, book a discovery call with us. We'd love to hear and see how we can help you. And as coaches, what's one piece of advice you'd share with healthcare professionals as we start to hit the holiday seasons here to stay joyful and stay grounded?
I would say don't sweat the small stuff. We have all these goals of being the best we can and showing up for our family and at work. And sometimes we want all the details to just be right. If something doesn't get done that's not terribly important, just let it go and don't beat ourselves up over not achieving everything that we set out to achieve. Obviously, if you're in the emergency department or you're treating patients, that's a whole different story, but I'm really thinking about the smaller stuff.
I agree. Just getting back to keeping those basics and what are our main values, but is holding our boundaries and all of those types of things that it doesn't have to, or I like to say we don't have to shit all over ourselves, right? Like I should be doing this, I should be doing that. It's really saying, what is it that I choose to do and how do I want to show up and serve and just be going back to the basics of med thrive too, right? What's our awareness and how are we showing gratitude and just keeping all of those pearls that in on site.
I've had this exercise with a few people lately where we look back on the year before, the year up till now, and breaking it down month by month and thinking of the things, major milestones or maybe small ones that have happened throughout the year. And when you do that, or when we all did this together, we looked at our year and it was a time to really celebrate. Wow, look at everything I went through. And also, you can reflect and see where you are now. I find that's really helpful to celebrate and look at what you have done.
I think for me, it's the slow down to speed up. I think that's probably the biggest life lesson that the pandemic taught me. And that relentless self care is really important because when you prioritize that, then actually the time becomes more efficient. Your mind is sharper. And so those regular breaks so that you can, with intention, choose what you need in the moment, whatever self care that you need.
Yeah, it's so easy to have these big, dreamy goals, whether that be for the holidays or by the end of the year, right? And then maybe not achieve them to the aspect that you wanted to. But then to go back and just reflect on where you've come so far to this big dream that you may have had and just celebrate those small wins, which I think will help really improve your time management and just make you feel much more joyful of where you've been. Because it's so easy to beat ourselves up when we didn't accomplish something that we wanted to do. And I find that to be a very kind of rewarding experience to get a step back, as everyone mentioned, and not sweat it, take a deep breath and move on one step at a time. So how can healthcare workers with all this find moments of celebration and reflection amidst the holiday rush, or if they have to work during the holidays?
So I actually really it is lovely to work through the holidays because you party with your work family and you bring your food in and it is a time of celebration. It can feel busy, so I have to admit there's a reason why many of my Instagram reels go from the car with me buckled in still because that's the only time I have those red lights. We're sitting in line waiting to pick up kiddos. Just find those, and that's actually the advice I always give everyone: is take your breath and meditate in the car. So for me, it's just finding those little times and that you can just linger a little longer in the break room. You can take another 2 minutes. It's fine. In the bathroom. It's like the really simple little things. You can just hide a little bit longer. It's okay.
And for me, it's thinking about the choice. I have the choice of how to show up in the next encounter. I have the choice of how much to share or not share. And I think it's keeping in mind also that there's no mistakes. So learn from it. If you didn't feel good with the way you showed up the day before, the hour before, the minute before, you can choose to step in differently. And that way to say, okay, I don't want to keep feeling that way. So this is one small change that I can do.
The word connection comes up for me, especially when you have eye contact. It helps bring you that statement, be here now, and not rushing through the patients to actually, you may still be busied and harried and have a lot of stress, but that moment of connection as you interact with someone, whether they're the patient, a family member of the patient, a colleague, someone just walking down the hall. And that moment can really help recharge and regain not only the connection and help the other person, but help you connect and get a little more skip in your step and raise your energy level as well. I always find that small moment, it makes such a huge difference.
I'm just going to summarize. I think it's incredible what you guys all said, and I totally resonate with it is choosing to slow down, to be in the moment, to give yourself a break when you need it, but to also connect with people because a lot of people are going through similar to things. They may not be wanting to work during the holidays because they want to be with family and friends. They may be having some kind of stressor or challenge at home that they need to get back to. They may have not set up for the next day when they're celebrating for New Year's, that they have all these ideas and want it to be perfect for their little ones when they go home, right? There's so many things that could be running through people's head, but knowing that we can connect with our patients, with our colleagues who are going through a similar situation can really help us really slow down, be grateful for where we are, and then to also re-energize us, as Amy mentioned. So I'm curious, everybody, what's one thing you're excited to focus on or do in the coming year with the podcast or with transforming healthcare coaching?
I'm excited to spread the word more, whether it's through podcasts or conversations with the right people in the right organizations, but just to show the value that we can bring and provide and just basically build our brand and help more people.
I'm looking forward to hearing the testimonials and witness the transformations of people that are being able to come across our path and just it's, I'm waiting for that.
I'm really excited in our groups that we offer at our MedThrive groups, the group dynamics and the healing and the community and the laughs and the tears and the understanding that has this ripple effect. And I'm really excited to see that grow.
Think for me, well, I'm really excited to help more people who are healthcare executives and leaders, primarily because we know that can affect so much more change for so many more people. And for the podcast, to actually answer your burning questions. So to have more comments and questions and topics and speaker recommendations from you, the audience. So we're looking forward for Klaus' inbox to get really full at podcast at transforminghealthcarecoaching.com. So that's what I'm looking forward to as we continue to build out our YouTube podcast channel.
Yes, please send me an email. And that email, by the way, is podcast at transforminghealthcarecoaching.com again. Or just leave us a review on either Spotify, Apple, or YouTube. We check those out as well. Or even on social media, you can reach out to us on Instagram or Facebook, or even LinkedIn. We are very active on all these sources. But I agree. I think it's so hard to say one thing that I'm excited to focus on. I agree. I'm excited for the more reach to people. We really do offer something so great for healthcare professionals. It's the reason that we all jumped into this and why we're specific with healthcare professionals. We're very passionate about our community. Through the MedThrive program, it has been an incredible honor to see how we've connected healthcare professionals from all over the US and who are from different specialties, from fellows to PAs to nurses to techs, who are all talking to each other as humans and growing into the life that they desire and overcoming obstacles and challenges that are specific to healthcare professionals. It's just an incredible thing to witness. So if you're interested, please reach out to us and we'd love to show you our MedTribe community. We had mentioned here, you can send us a message through those various sources, but what's one way we can involve our listeners more this coming year?
We're hoping that people leave comments and also shares because when we have more listeners and more shares, we're hoping that we'll be able to see what resonates with you and which episodes are better. So feel free to please leave us a review and also contact us on all of our socials. So we're on Instagram, Facebook, and LinkedIn. We'll be actually releasing some newsletters in 2025. So I guess a sneak leak right there. But we just want to actually engage with you because we want to hear what issues and challenges you're facing, and so that we can tailor our episodes to meet you where you are.
And I think it's just sending out that invitation to everyone that's listening is to engage in that. That's where the growth is happening. Right? When you say, what do I think about that? Or how can I change myself from this level to that level? So I think I am inviting everyone to participate.
And we understand that our viewers are from all walks of healthcare. We know we have physical therapists, we have occupational therapists, we have physicians practicing in urology, neurology, emergency medicine. We have ultrasonographers, we have nurses, we have techs. You all have different challenges and obstacles, and we would love to hear what yours are so that we can help, begin those next steps to overcome them in the best way possible if the podcast is your outlet. As we finalize this episode, what are your hopes for our listeners as they wrap up this year and prepare for the next year?
I hope they take Grizelda's challenge and engage with us. Engagement and showing up is what we would like. So we'd love to see more people and hear from more people.
For me, I hope everyone sees this as the gift that we've been giving, right? Where throughout the year and you didn't have to wait to the holidays to get it. So if you hadn't opened up this gift before, go back and listen to the prior episodes, but just keep growing with it.
I would say for me, my holiday wish for everyone is to have their foundation well set, which begins with them, and to take the first small step to making sure that they are well first. And the first step is often just finding a partner, a secret person, a guide on the side to be able to help you along that way, whether that be in maybe one of our group programs or on one-on-one, is just to be able to have their foundation be well, which is with their mental and physical health, and that there is hope. So I wish hope and health for everyone.
I saw this blurb this morning online, and it was a child or someone said, in order to be happy, one needs to have someone to love, have something to do, and something to hope for. And I thought, isn't that beautiful? It's so simple and so true. So working on your list and engaging and setting some goals so you have some hope.
And I hope for number one, everybody to have a happy holidays, where that happy holidays is true, where you're actually happy, you're joyful, you're in the moment, you're grounded, you're fulfilled. Work is staying at work and home is staying at home, and you are being fully present in the moment for the holidays, for the ones that you can. If you have to work, but I hope you are taking the time for yourself to start embodying some of the things that we've talked about in these episodes, whether that be some PQ reps, right? Or taking some deep breaths in the ambulance bay, taking those steps for you. And then as the year comes on, I hope that you can prioritize yourself, your well-being, and your growth as we walk that same journey with you guys. And we'd love to partner with you if that is a little bit hazy and you don't know where those steps are, and the episodes have intrigued you enough to begin those steps. And we thank you from Transforming Healthcare Coaching for joining us this year and celebrating with us today. And please leave us a comment, even if it's not something you want us to talk about. We'd love to hear what your successes were this year, what you're celebrating this year, and what you're happy for during these holidays. Thank you.
Awesome. Happy holidays, everyone.
Happy holidays.
Thank you so much for listening to the Transforming Healthcare Coaching podcast. If you found this episode interesting or useful, please share it with your friends and colleagues in healthcare. And we will love it if you hit subscribe so that you never miss an episode. We want to help with the topics and problems that you want us to talk about. Leave us a review wherever you listen to us with suggestions, feedback, and praise. It means so much to us, and we actually read every comment. For deeper support in your life and work as a healthcare professional and leader, head over to transforminghealthcarecoaching.com. Download our free 5 reflection questions to jumpstart your journey and join our email list to be the first to know about our coaching programs. We're also excited to offer the MedThrive community, a supportive space for group coaching and self-paced personal growth, providing an alternative path to growth beyond one-on-one coaching programs. Find out more and join this thriving community at transforminghealthcarecoaching.com. Together, we can transform healthcare, one person at a time.